Hey everybody, welcome to the Earn It Podcast, and on this episode, we're going to go over NCLEX question traps and how to beat them. All right, first of all, obviously, I know it's been a while. Nursing school, everything has been absolutely crazy, but we're going to hit the ground running with this episode. The first thing to go over is the word twist trap. This is actually kind of a bonus because we have multiple different aspects in one. So what is the trap basically? So students, whenever reading the question, you see the condition and you jump straight to what intervention is for that condition. In other words, what do we do for that condition? So there are specific keywords in NCLEX questions. First, best, immediate, and most important. First, generally, you need to think about, first and foremost, the nursing process, ADPI. So usually, it's assessed before you intervene unless it's emergent or unless it's an ABC issue, right? And so this is really tricky because you have to... it's like one of those things. It's kind of like an inside joke, even in nursing school, right? It's like you always assess the patient first. Obviously, there are some issues where you're not going to do that, right? If you walk in and see your patient blue, you see that they're not breathing. What do you do first? Assess the patient's vital signs? Probably not if they're blue and you can see that they're not breathing, okay? Best. So for the best, what's going to happen is multiple answers are going to be correct, and you just have to pick the most effective or the most safe. Really, the NCLEX is a safety kind of thing, and just to make sure that you paid attention in nursing school, right? You know the general rigmarole of how to figure stuff out. It's a framework, right? Immediate. This is time sensitive, this is emergencies, this is urgencies, and then most important, right? So most important means that you are prioritizing. So you might think that first is prioritizing, but another way of prioritizing is, most important. So this is just a priority of ABCs, Maslow's, acute versus chronic, expect versus unexpected, Maslow's, I think I said that already, and safety. What I personally, I'm going to throw this in here, especially when you're talking about nursing interventions. Let's say you get to a question and there are interventions. There are going to be some that seem kind of wonky, but you could maybe make sense out of why you might do that. This is when you're slightly too unfamiliar with the material. This goes for your nursing school questions as well. And this is something that I wish I would do more, and I strive to do this more. But whenever you are looking at a list of nursing interventions that you're given in school, whether it's from the book or from lecture or from questions that you've gotten wrong, no matter how simple it is, you have to realize why. And I would go out of your way, even if you have that much extra time studying, I would go over some things that you absolutely do not do. Because what happens is there'll be something that's kind of weird in the question, and it's actually a bad idea, but you don't know that that's actually a bad idea. You just think that it's something you forgot on the list, and you know exactly what I'm talking about. You think it's something that you forgot on the list of interventions because you're memorizing lists of interventions. If you don't know the why behind everything, then you won't know the why not for the things that you're not supposed to choose. Here's the thing. Again, people lock onto the disease and think, what do we do for it? Instead of thinking what phase of the nursing process this is. So here's how to avoid this. You can, either underline, circle the word before reading the options and ask, is this an assessment question or is this an intervention question? So here's a quick example. A client reports new onset chest discomfort and looks slightly anxious. Which action should the nurse take first? A. Administer sublingual nitroglycerin. B. Apply oxygen at 2 liters per minute via nasal cannula. C. Obtain a complete set of vital signs. D. Call the provider to report chest pain. So pause this a second and think, are you given nitro, oxygen? Are you obtaining a list of vital signs? Or are you calling the provider? So here's why it's not the provider to report chest pain. Now, in reality, are you going to do this? Yeah. But if you do so without a set of vital signs, you're going to be in some serious trouble. You're not going to apply oxygen and walk away. You're not going to look. Here's the thing. Here's why you're not going to give nitroglycerin. You have to think about what the different side effects of what does nitroglycerin do to you? It drops your blood pressure. If you have this patient with new onset chest discomfort and you don't obtain their vital signs, they could have a low blood pressure. And then when you give them their nitroglycerin, you're in really big trouble, right? There could be all kinds of strange reasons for chest discomfort, all kinds of crazy reasons, right? So if somebody has a blood pressure of 80/50 and you don't know it and you give them nitro, you have a serious issue. Applying oxygen, sure, but no. In this case, we use the keyword first, which I previously said is ADPI. Usually it's assessed before intervene, at least with these other options. So the correct answer here is obtain a complete set of vital signs. So first of all, the word first points you to the nursing process. There's no information about unstable vital signs or respiratory distress for the oxygen or acute deterioration. This is not a drop everything and oxygen right away scenario, right? Assessment comes before most interventions. Vitals are objective data and they determine how unstable this chest pain is. Remember, stable versus unstable angina. Nitro and oxygen and provider notification are all reasonable next steps based on what you find, right? So if the question had told you that the patient was pale diaphoretic and had an oxygen of 84, we would skip to that oxygen because ABCs override the slower assessed first approach. In other words, you know what you give oxygen for, right? Breathing issues, low oxygen. So if you don't have that data, you are not to assume that there's low oxygen going on there. So, number 2, the all true wrong priority trap. So what is this? What does this mean? All options are technically things you would do, but the NCLEX wants the correct order priority, not everything we will eventually do. Because the problem is we look for what's right instead of what is right first. Unfortunately, this means that we kind of have to think about a checklist in our head sometimes. This is specifically dealing with multiple choice questions. I think a select all that apply and how to attack those could be a completely different podcast episode in and of itself, or a YouTube video that I'll do. So here's a little bit further. Here's how to avoid it as a trap. You need to ask yourself in questions like this: if I can only do one thing in the next 60 seconds, what most affects safety? So here's an example. A client with a suspected stroke arrives to the emergency room with slurred speech and right-sided weakness. Which action should the nurse take first? Obtain a blood glucose level, prepare the client for a CT scan, perform a complete neuro assessment, notify the provider of a possible stroke. Now, here's another thing that you could get confused about. If you have slurred speech and right-sided weakness, it may be policy at your hospital or wherever you work or wherever you have done clinicals at to do something else first other than the correct answer for this. You need to separate what you have been told at work is the kind of priority. What you have been told is the policy to do with a certain specific set of symptoms. So, the answer is to actually obtain a blood glucose level in this case. Remember the question, what can I do in the next 60 seconds that could affect things most? If you obtain a blood glucose level, because obviously we know it's the same thing for seizures. Status epilepticus. If you're, yeah, obviously give that IV lorazepam, but then you're going to check a blood glucose level right away. You're not going to rush the patient to an MRI or CT or get an EEG on them, because you could rule out literally in 60 seconds any kind of neurological issue if you have a blood glucose reading of 40, right? It's the same thing with slurred speech, right-sided weakness, because we know blood glucose affects everything, but especially neurology, right? So hypoglycemia can mimic a stroke, and you have to rule out a reversible cause right away. The CT, the neuro exam, and provider notification all do matter. But this is a fixable emergency. They come first. So you're going to do ABCs, right? We're not having an airway issue. We're not having a breathing issue. We're not having a circulation issue. Now we're talking about fixable emergencies. And that would be blood glucose level. A CT scan isn't going to be done in 60 seconds. Your neuro assessment isn't going to be done in 60 seconds. Notifying the provider of a possible stroke. Okay, why? Well, slurred speech, right-sided weakness. Okay, and what troubling data do you have for waking me up at 2 a.m, nurse? Oh, well, they that's it, right? You have to get something else. Again, are you going to perform that assessment? Yes, but that glucose level, you can rule out a reversible cause immediately. Your assessment is not going to rule that out, okay? And this could be an emergency situation. So it says, which action should the nurse take first? And in the previous example, it would have been to do the assessment. But this is an emergency situation. So we're going to get that glucose level. You can think of that as an assessment. And this would think of that question. If I can do one thing in the next 60 seconds, which most affects safety, right? That glucose level has a lot more serious consequences than your neuro assessment will, because you know they have slurred speech and right-sided weakness. So as far as you're concerned, you have neurological data to go off of. Get that glucose level and move on. So the skipping assessment trap. In other words, acting before you know enough. So this is intervening without adequate data. Students remember the right drug or the usual intervention and jump right to it. So here's what you need to do to avoid this. You need to ask yourself this question. Have I actually assessed enough to justify this intervention? Here's an example. A post-op client reports pain at 8 out of 10, 2 hours after receiving IV morphine. What should the nurse do first? Now, here I'm going to read that again, because I can see this looking at this question. It can get you tripped up. A post-op client reports pain at 8 out of 10, 2 hours after receiving IV morphine. What should the nurse do first? A, administer another dose of IV morphine. B, assess the surgical site and vital signs. C, call the provider for a new prescription. D, document the client's report of pain. So, this is assess the surgical site and vital signs. So, this kind of pain could indicate some kind of complications, bleeding, infection, compartment syndrome. We don't know what kind of surgery this is. We don't have hardly any information other than they got the IV morphine and they got the pain. You have to assess before you medicate, because you need objective data and a focus assessment to guide your intervention to be as safe as possible, right? Now, in a lot of hospitals, this makes sense. Usually before giving a medication like morphine, whether it's, scheduled or what, you're doing a pain assessment, and a lot of times it requires you to put in a pain assessment when you're documenting that medication administration. So that's why this should make sense. Think about, this is one example where thinking to your real world experience could actually help you out, because you're like, wait a second, yeah, before I go giving somebody morphine, it asks me about their pain, all that good stuff. The important part here is you don't ignore that this is a post-op client. Okay? The irrelevant detail trap. Usually, I feel like in nursing school, we have been prepared enough for this, but I don't know what nursing school you are all going to that are listening to this. So, age, job, time of day, family stuff, random comorbidities that don't change the priority. This is the really big one, right? They're giving you medical information that's not relevant, but it's medical information, so you think it's relevant. And then you second guess yourself when you're reading the question because you think, oh my gosh, should I be connecting a dot here? No, not all the time should you be connecting a dot. Why it works is because it feels kind of strange to ignore information and the brain tries to use everything. So the reason why how you avoid this is to strip the stem of the question down to two of the following. Who is my patient? And what is the main problem? You start there. Like this. A 34-year-old teacher with a history of eczema arrives in the emergency department after twisting her ankle while running after her child at the park. The ankle appears swollen and bruised. What is the priority action? Is it A, ask her eczema triggers? B, apply ice and elevate the ankle? C, notify social services? Or D, teach proper lifting techniques? So, here's the irrelevant stuff. History of eczema. What is the main problem, right? It says the ankle, and here's what points to it. I'm going to break it down a little bit further than what I have on my notes here. So we have a 34-year-old teacher, right? Okay, that's fair. With a history of eczema, okay. Arrives to the ED after twisting her ankle. So, what's bringing this person into the emergency department? Is it the eczema or is it the fact that they twisted their ankle? Right? This is twisting their ankle. Okay? Furthermore, if you're still confused on it by the end of reading this, it gives you more data on the ankle twisting. It says the ankle appears swollen and bruised. It doesn't say the eczema rash is bleeding. It doesn't say that, does it? It's giving you more details on the ankle. So again, we have the twisting her ankle while running after her child at the park. That is not useful information either. So far after reading all of this, we have 34-year-old teacher twisted her ankle, and now we have ankle appears swollen and bruised. So the patient is the 34-year-old teacher. The problem is swollen and bruised ankle after a twisting injury. You're not going to ask about eczema. You're not going to notify social services. And the patient wasn't lifting anything, right? So we are going to apply ice and we're going to elevate the ankle. It is as simple as that. The job, the eczema, and raising the child are fluff, okay? Swelling and bruising equals a musculoskeletal injury, and that equals basic Rice principles. It's as simple as that. Number 5, the opposites trap, right? So what is the opposites trap? It's two options are direct opposites, increase, decrease, restrict, encourage, etc., etc. One of them is often correct, but not often, not always. So why does this work? Your brain wants to pick the one of the opposites because it assumes NCLEX's trick must be between those two. But that's not always the case. So let's just, here's what you're going to do. Which opposite, you're going to ask yourself, which opposite is actually consistent with the pathophysiology? Here's a really simple example. I try to keep these simple because a lot of these can be long-winded, right? For a client with constipation, which dietary teaching is appropriate? Decrease fiber intake, increase fiber intake, decrease fluid intake, avoid physical activity. Okay, so we have decreased fiber intake and increased fiber intake. And then we have decreased fluid intake. between the fiber, obviously, because these are the two where we have the opposites. Your brain wants to pick one of the opposites, right? So, do we decrease fiber for constipation? We do not. Now, there are issues where certain types of IBS, and we can kind of put IBS-C in there, and generally we want less fiber because it's a GI dysfunction. But it doesn't say for a client with a history of IBS, does it? It says, client with constipation, which dietary teaching is appropriate? Increased fiber intake, we should know because that bulks everything up. We don't want to decrease fluid intake because basically the bowels need fluids, so it's not so hard and dry and difficult to pass. And then avoiding physical activity is the exact opposite that we need to do. We want our patients to get up and move around and walk. So this is one of those cases where you have decrease, increase, decrease. It can get really confusing, but just treat it like any other question, and just go through and say which one of these is good for this pathophysiology. Which one of this is consistent with it? So the comfort versus safety trap. What is this? There's a therapeutic, comforting answer that looks nice, but there is a safety intervention that is more appropriate. The reason why this works is because nursing school drills in us that therapeutic communication. And we tend to start to overvalue it, especially for those of us that find therapeutic communication questions really difficult. So we spent a lot of time on focusing on it. So you have to ask yourself this question. Will this answer actually keep the patient safe physically? Okay, here's a quick example. A confused post-op client is trying to climb over the side rails. What is the priority? Is it A, reorient the client to person, place, and time? Is it B, provide a warm blanket and dim the lights? Is it C, move the client to a room closer to the nurse's station? Is it D, ask family to stay with the client? So, here's the thing. This is a confused post-op patient. So they have had surgery. This person keeps trying to climb over the side rails. This is a safety issue. Now, it may be very tempting to say, yeah, well, when somebody's confused, we reorient them, right? That is true. But that is not the safety issue here. Warm blanket and dim the lights might relax the patient, but that is not addressing the underlying safety issue. Moving the client to a room closer to the nurse's station is the correct answer here because closer observation will reduce the risk of immediate harm. If you can ask family to stay with client, well, here's the thing. That family is not responsible for that patient. You are still responsible for that patient. And then it's unreasonable to be like, hey, this person keeps doing this. Can you just stay here? Also, visiting hours are up eventually. Doesn't matter what floor you're on. You don't want family to be responsible. Like, under what other circumstance do you trust family that, you're going to hand them your nursing license? I don't think so. So, number 7. The absolute language trap. So this is words like always, never, guaranteed. So what these are is these are that certain options use extreme language and they're usually wrong in healthcare. The reason why this works and why this tricks us is because we think that strong wording is equivalent to a confident and correct answer. So we should basically always be suspicious of always, never, must, guaranteed, or only, right? These are pretty easy for most of us to avoid that have gone through nursing school. And if you're still going through nursing school and you're struggling on your tests, then this should help you. I don't know. I feel like most people are able to easily get this, but here's an example. Which statement indicates correct understanding about antibiotic therapy? A, antibiotics will always cure the infection. B, I should finish all of my antibiotics even if I feel better. C, my antibiotics will guarantee I never get this infection again. D, I can stop taking them when symptoms improve. So there are two factors at play here. there are two, even if you don't know terribly much about antibiotic therapy, let's say you haven't looked at antibiotics in 6 months, right? Let's say you're in your last semester and you're just focusing on your practicum and you haven't had to take tests and you're really enjoying it. So maybe you forgot a little bit about it. Now, this you probably wouldn't forget. This is an easy example because we're trying to highlight the traps. So these are easier questions. Over a podcast, you need easy, right? If this was a video, I could do difficult questions. Which statement indicates correct understanding? So the trap, A and C have always and guarantee in them. You are going to immediately get rid of these. Now, for antibiotics, do you stop taking them when symptoms improve, or do you finish all of your antibiotics even if you feel better? Obviously, we finish even if we feel better. And we know antibiotics don't always cure the infection, but even if you didn't know that, if you know about this trap, you wouldn't choose that. And you should never choose anything with always guarantee, never must only. Now, 8. This is a big one. The partially correct trap. So in other words, the right concept, the wrong context. This is when an option contains something true about the disease, but doesn't actually cover the specific question being asked. This is a huge one. What happens is your brain recognizes that the concept is there and it hits accept without checking the focus of the question. How you avoid this would be to ask yourself the following question. Does this option fully answer what they asked in this situation for this patient? So when you're answering, it should always be specific to the patient and to the situation in the question only. That is a really big deal. Okay, here's a quick example. A client with heart failure has +3 pitting edema and shortness of breath when laying flat. Which action should the nurse take first? So, A is educate the client about a low sodium diet. B, also take lung sounds and check oxygen saturation. C, weigh the client to monitor fluid status. And D, document findings for the next shift. Here's the issue. All of these are at least partially correct. You are going to educate the client about a low sodium diet because they're literally in with +3 pitting edema, shortness of breath. And they might be there because they have been eating too much salt and they got exacerbation from that, right? But it doesn't tell you that, right? It doesn't say a client was eating McDonald's and then, 6 hours later showed up to the ER, with all this stuff. It doesn't say that. You are going to weigh the client to monitor fluid status. You are going to document those assessment findings. Especially, this is harder almost. Whenever you go and you're going through clinical and you do your assessment, right? You're gonna, you note +3 pitting edema, shortness of breath when laying flat. You're going to chart that. So that is correct. You are going to document those findings. You are going to educate the client about low sodium diet. You are going to also take lung sounds and check oxygenation, and you are going to be weighing them daily for fluid status. But the correct answer here is B, and it's for a couple of different reasons. One is that right now we have shortness of breath, and we have the edema. So this means possible pulmonary congestion. We have to assess the lungs first. Now, I don't care what it says about the lung sound. If one of the options were to sit the client up and put them in a tripod position or whatever, that might be a little bit different. But in this situation, we have two different reasons. One, we're thinking about kind of like our ABCs. But also, the last word of the question was the word first. And the number one, the example that we talked about were these words. So when you say first, you need to think about ADPI first. And in this case, it happens to be true for multiple reasons. You're going to also take the lung sounds and check oxygenation. This is an assessment, and you are going to perform it first before all these other things. Education is a nursing intervention. Weighing the client is a nursing intervention. Documenting the findings is like neither one of those things. Now, the Maslow misuse trap. In other words, we're forgetting physiology. So sometimes us students can prioritize emotional comfort over physiological stability. And because we are nurses and we're going into the field for a reason, right? In other words, we want to be kind and caring to people. But the NCLEX wants safety first. It's all about safety for the NCLEX. So here's how you're going to remember. You're going to remember the order. Physiological, then safety, then love and belonging, then esteem, then self-actualization. Maslow's is important. And here's an example where this is going to be pretty difficult. A client with asthma appears anxious and says, I feel like I can't catch my breath. Which action is priority? A, encourage the client to talk about their feelings. B, teach relaxation breathing exercises for stress. C, assess respiratory rate, lung sounds, and use of accessory muscles. And D, ask about recent life stressors. Now, this can be difficult when you say to teach relaxation breathing exercises, because with asthma, sometimes we can, have somebody kind of relax themselves and, the word breathing is in there. So sometimes maybe we're just going to show them some breathing techniques whenever things start to get difficult, and that's going to help them breathe and move air. But in this case, of course, it's assess the respiratory rate, because all of these other things are kind of Maslow's. And we have the word anxious in here, but we should also know that anxiety is a symptom of breathlessness, early signs and symptoms of hypoxia, right? So this one's relatively simple, but when you have a bunch of Maslow stuff and something that isn't, it might be that. I wouldn't automatically choose that. You also have to make sure that it's important in this case to the situation of the patient, right? They could have done a bunch of Maslow's and then thrown in, instead of assess respiratory rate, they could have thrown in some other safety-related nursing intervention, but that doesn't relate to asthma or anxiety, right? 10, chronic versus acute change. But this is basically when long-term problems versus new or suddenly worse problems. The NCLEX prioritizes new, sudden, or anything that's changing. The reason why this tricks us up is simply because we get distracted by diagnoses with big names. So we need to see and check for words like new, sudden, increasing, worsening, acute, or something that just started. And these are really good with prioritization questions. Prioritization questions are the most complex questions on any nursing or NCLEX question. Because if you want, you can make these extraordinarily complex and involve ADPI in each one, ABCs in each one, Maslow's in each one, right? And also if something is acute versus chronic, and the trickiest one, expected versus not expected. Because something could be very alarming, right? Chest pain, shortness of breath, but they're diagnosed with a PE, so that's expected, right? So, which patient should the nurse see first? A patient with chronic COPD who reports a productive cough in the mornings. Probably not. A client with type 2 diabetes who missed one dose of metformin. Probably not. A client with heart failure. A client with heart failure who reports new onset shortness of breath when walking across the room. We have the words new onset. That should put up a flag. Let's read what D is. A client with long-standing rheumatoid arthritis has hand stiffness in the morning. This is chronic. This is expected. So obviously, when we have new onset shortness of breath, right? Now, if it said a client with heart failure who reports shortness of breath when walking across the room, that might be kind of expected. And then you would have to fall to your ABCs, right? And that might still be the Yeah, that would probably still be the answer, even without new onset, because you would fall into your ABCs at that point, right? However, we have new onset. So even if it said a client with chronic COPD reports shortness of breath, and then you have a client with heart failure who reports new onset shortness of breath, it would be the new onset because that's different. Okay? Couple more. Negative stem trap. So this is a statement that indicates the need for further teaching. This is the, I don't know about you guys, but me personally in nursing school, this trips me up the most. And that is a question that ends, which of the following statements indicates the need for further teaching? Now, as an instructional designer, and as someone who studied how to create tests properly, this is borderline. Because it's generally a universal, I wouldn't say requirement, but standard to bold and capitalize words like not, except, incorrect. But in the case of the NCLEX and nursing school exams, they do not do this. They don't do this in nursing school because they don't do it on the NCLEX. So when you have further teaching, it may not be bold. And it's your job to immediately do something, highlight it, whatever you got to do. So that's the trick to it. Double, underline, highlight, whatever you got to do. Which statement by a client taking furosemide indicates the need for further teaching? A, I will weigh myself every day. B, I will report ringing in my ears to my provider. C, I will increase my potassium-rich foods. Or D, I will avoid foods high in potassium. Now, furosemide is not potassium sparing. It gets rid of potassium. So if you're going to avoid foods with high in potassium, then you're going to end up with low potassium. So the correct answer is D, because it's not correct. So in other words, it's a negative that's hidden. It's a hidden negative. The opposite of that would be like, which of the following indicates a correct understanding or an adequate understanding of the patient, right? So further teaching, you need to treat it as a big bold. Okay? This is the big one, and I think I'm going to do a whole breakdown on this in a different episode. The select all that apply overthinking trap. So, thinking that you have to pick 2 or 3, or that the select all that apply is most of the above. So, the reason why this works is because you have seen so many select all that apply questions, and it's never just one option. But what you should do is you should be open to the fact that you could see a select all that apply question, and there's only one of them that are correct. There's nothing wrong with them doing that to you. And again, I know I've had teachers make this very clear. So if your teachers haven't made this clear, you just need to, of course, treat each and every option as a true or false. And no guessing about how many of these, you need to pay zero attention to how many you're choosing. It does not actually matter whatsoever how many options you're choosing. The only thing that matters is if the statements are true or false. Okay? And another trick with these that I didn't put on here is if you don't know because you're not really familiar with it, it's best to leave things out rather than click another one, because if you do an incorrect option, it will cancel out one of the correct ones that you chose. So you're going to get less credit, if you choose one that's wrong than if you don't choose one. So here we go. Which interventions are appropriate for a client with neutropenia? Select all that apply. So, A, avoid fresh flowers and potted plants in the room. Is this true or false? This is true, right? These could have microbes and all kinds of other stuff for somebody with neutropenia. B, encourage raw fruits and vegetables. No, it shouldn't be that way. They should be cooked because this patient is neutropenic and in higher risk for infection. So far we've chosen A. C, perform frequent hand hygiene. Obviously, anytime you see hand hygiene, it needs to be correct. Okay. D, limit visitors who have infections. Obviously, that's true. So far we have A, C, and D, avoid fresh flowers, perform frequent hand hygiene, and limit visitors who have infections. E, give live virus vaccines. Do we give live virus vaccines to people with neutropenia? We do not do that. So here we have A, C, and D. So just a simple true and false thing. So thanks so much for listening. If you liked this podcast, please go ahead and follow. Link in the description if you want to be on the podcast. Looking for guests right now. Everybody is really busy, so it's been really difficult to get some down. So if you're a nursing student, future nursing student, I'm actually looking for nursing students especially, and any future nursing students to come on and talk about your experience getting into nursing school. And because I think we all have our issues with it. And, I'd like to just explore that a lot. So go ahead and subscribe for more, follow, leave a comment with your feedback. Thank you so much. Go out there and earn it today.